अब जो मामला है वो थम गया है इस हवाले से कि पाकिस्तान ने एक शानदार जीत जो है वो अल्लाह पाक ने
that game is up. First, I'm directing the U.S. Trade Representatives. They don't have to sell cars into the United States anymore. Investigations into foreign nations that extort drug companies. They won't get cute by blocking their products unless they accept bottom line. They were given a price by amount.
आप सुने आप माइक से डिले होगा ना।
runs for bank constituents and eliminate this discrepancy. This is between Europe and the United States. This is an extraordinary day. I know we're doing it in so many ways and promises that politicians make clear that 20 years pharmaceutical lobby will never have to do it. And the reason the Senator on Capitol Hill never is because they know that for policies that he was to eliminate this discrepancy. Pharmaceutical companies between industry and the United States, at least one pharmaceutical lobby is the next largest lobby. Who has the courage. President Trump was taking money from the pharmaceutical industry too. I think they gave you $100 million. But he can't be bought, unlike most of the politicians in this country. And he is standing here for the American people. I don't know what, there's writers like Lord Elizabeth Warren or Robert Reich who are saying that President Trump is on this side of the oligarchs. There has never been a president more willing to stand up to the oligarchs than President Donald Trump. And I'm very, very proud of you, Mr. President, for your courage, I'll say, because I don't want to be crude, your intestinal fortitude, your stiff spine, and your willingness to stand up for the American people. We have 4.2% of the world's population. Our country represents 75% of the revenues for pharmaceutical companies. We spend in our country $1,126 per capita on drugs. In Britain, they spend about $240. They spend 1/5 of what we do. And this is true across Europe. And the drug companies, Europeans, if you ask them, it made no sense what they were saying. America has to pay for this innovation or it's not going to happen. What President Trump is saying to our European partners is you've got to raise the amount that you're paying for those drugs and pay for your share of the innovation. That the United States is no longer subsidizing that. If the Europeans raise the price of their drugs by just 20%, that is $10 trillion that can be spent on innovation, and the health of all people all across the globe is going to increase because we're going to have better products. So I'm just so grateful to be here today. I never thought that this would happen in my lifetime. I have a couple of kids who are Democrats, are big Bernie Sanders fans, and when I told them that this was going to happen, they had tears in their eyes because they thought this is never going to happen in our lifetime, and we finally have a president who's willing to stand up for the American people. Thank you, and Dr. Oz.
Thank you, Secretary Kennedy. This is the most powerful executive order on pharmacy pricing and healthcare ever in the history of our nation. And it's only happening because we have a president with the fortitude, the guts to stand up to the withering criticism and lobbying that's going to occur as soon as folks hear about the executive order. So on behalf of the child in Philadelphia who's got an autoimmune disease with a $1,000 a month drug, or the older woman in Los Angeles who's on a blood thinner who can't afford her copay, I want to thank President Trump. God bless you for having the guts to take on this industry. Thank you, sir.
Thank you very much.
So let's talk about the details a little bit. And this is primarily about equalization, as President Trump said. It's about fairness. Think of NATO as a metaphor. When President Trump said, you've got to pay a little more so it makes sense for all of us, they came up, and the European countries contributed. The same thing we believe will happen in this situation. Most people who have thought about this process agree that it is patently unfair to tolerate the numbers that Secretary Kennedy and President Trump have reflected to you. On this chart to my left is a list of the 10 drugs that were negotiated in the IRA. Again, this is the bill, the law, that regulates a negotiation process. This is the best price that was able to be obtained by the Biden administration. And if you look at these numbers, they actually reflect how much on top of the most favored nation price was being paid by the United States. So the closest to me, Bob, you can point to the Jardiance, the closest one, 289%, the one that's closest to you. That means that we are paying in America 4 times more than that drug costs in other countries. Again, 100% is the baseline. It's 289% above that baseline. It goes all the way down to when we're paying 50% more than any other country. That's the range. As was pointed out by President Trump, half the time we're paying 3 times more than is paid in other countries. It doesn't make any sense for the system. That stated, President Trump has over and over again indicated, and Secretary Kennedy reflected as well, we want innovation. We want our technology partners doing the best they can to make the best solutions for drugs to cure as many people in America and around the world as possible. By getting our allies to pay a bit more, as they should be, and they should have for many years been doing, will course correct a problem that's gotten out of hand. And by doing that in a thoughtful, effective way, we're going to be able to get the pharmaceutical industry whole. Those jobs will still be here, will still be productive, will still be curing cancer and a slew of other ailments that plague humanity. America will still be the leader in this space, but we'll be paying the appropriate amount, the right-sized amount for those tasks. So over the next 30 days, the 4 of us up here, together with people standing in the back of this room who are doing a lot of the heavy lifting, are going to be approaching pharmaceutical companies to talk specifically about what we want the most favored nation price to be based on the best data we have. We're looking forward to a thoughtful interaction with these corporate leaders, many of whom we've spoken to and in quiet will agree the system is not right the way it is. They're patriotic Americans. They want what's right. But the fact that in my lifetime, as Secretary Kennedy said, for the first time, we have a thoughtful and aggressive approach thanks to President Trump, on taking on the special interests, should give all Americans confidence that this is an administration that stands for fairness, and it should chill the waters for those who believe they can push us away from our North Star, which is to take care of the American people. Mr. President, God bless you.
Thank you very much. Thank you.
Jay, you want to go next?
Sure. Yep. So I teach economics at Stanford as well as health policy. And one thing that's really, really simple in economics is that when you have a persistent price difference for the same product between 2 countries, there is something deeply wrong. And what President Trump has done is a historic measure that should have been done a long time ago. What we're going to do is make sure that those prices become much closer to equal, like a competitive market you'd expect. Right now what's happening is the American people are subsidizing in large fraction the research and development efforts for drug companies around the world by the higher prices that we pay. With this new order, Europe will share the burden of that. And in fact, if you may think of it as like as somehow it's going after drug companies, actually it's helping drug companies. Because what we're also going to do with this order, what President Trump has done with this order, is he's said to European governments, look, if you are taking advantage of the drug companies by forcing them to charge very, very low prices, we're going to defend American drug companies in Europe. At the same time, we're standing up for the American consumer who's been paying far too high prices for far too long. I can go back decades to point to congressional reports after government report after government report of tremendously high drug prices, much higher than the rest of the world, and nothing has been done about it until this moment. And I'm really, really proud, President Trump, that you've done this. I'm really proud to be included in this and looking forward to the work ahead.
Thank you, Jay. Great.
Thank you, Mr. President. On behalf of the many doctors I've talked to about this very issue, thank you for taking the bull by the horns. Presidents on both sides of the aisle have talked about this and floated it and said they've wanted to do it, so you've had the courage to do it. Thank you. I've been a surgical oncologist at Johns Hopkins for 22 years, and I have seen patients suffer. We didn't take an oath to heal patients and then watch their life get ruined financially with their home, mortgage, retirement, going down the drain with GoFundMe campaigns, raising money from church communities and synagogues and friends they haven't seen in 20 years to try to raise money for what? For a system where Americans have been getting ripped off by 10, 12, 15 times higher prices than we see in other countries. The fundamental problem in healthcare is that we've had non-competitive markets. And we can do little things around the edges, or we can transform those markets to competitive markets, and that's what this executive order does today. Imagine buying a Ford for $175,000